What about treatment of antibiotics for UTIs? Is this something that, Dr. Murillo, you prescribe as well?
Yes, I prescribe antibiotics for urinary tract infections when the urinary tract infection is diagnosed.
Right.
A urinary tract infection, and I insist this is a clinical diagnosis. Patient has to have symptoms in order to have a urinary tract infection. Mm-hmm. The presence of bacteria or white cells in the urine is not equivalent to a urinary tract infection. Presence of bacteria or pus in the urine indicates asymptomatic bacteriuria or asymptomatic pyuria. That means that they're present there, but they're not causing infection, and they do not require treatment.
Right.
It's very important because as people age, they may carry bacteria in their urine permanently, not causing any problems, and it's not infrequent to see that they start to treat them and give them many courses of antibiotics, and that's a way bacteria develops resistance. Treating situations that really do not require antibiotics and bacteria, and then that's the result. The final result, we find bacteria that are resistant to antibiotics, and then we run out of antibiotics to treat them.
Right. So, Dr. Murillo, can you tell us a little bit about what this illness is and why it's associated with antibiotic resistance?
All right, C. difficile, or now called Clostridioides, not Clostridium, Clostridioides difficile. It's an infection that usually happens because of the use or misuse of antibiotics. Whenever a person, this bacteria may live in a person, this Clostridium may live in a person, and if the equilibrium is not disturbed by antibiotic, equilibrium between other bacteria and this bacteria, they're inactive. Once you use antibiotics and you kill the other bacteria, this bacteria surfaces. This bacteria becomes active, produces a toxin. A toxin is a substance that stimulates the gut to produce fluid, and diarrhea comes. Okay, this is the way it occurs. So once you use antibiotics, you disrupt the equilibrium in our body, and this bacteria become active, producing toxin.